Natalie?
Yes.
Your room is ready? Follow me. Just gonna get your height and weight real quick. Go ahead and step on the scale.
Oh boy.
Okay. And we're in room 429. Just come on in and have a seat. Thank you. And we'll be right with you. Hi, Natalie. How's it going? Good. I'm just going to go ahead and take your vitals real quick. Kneel and cross your knees for me, please.
Okay.
Thank you.
You need me to take this?
Yes, please. And if I could just have your arm. Thank you. You can go ahead and put it down. Does that feel okay?
Oh wow, that's kind of high. I don't think my blood pressure is usually that high.
Okay, it is a little high, so I think we're just going to go ahead and talk to your doctor about that, okay?
So is 140 over 90 a high blood pressure then?
It is a little higher than we would want,
Okay.
so we're going to see what's going on. I'll come back with the doctor, okay?
Okay, thank you.
Okay, tell me about Natalie.
Okay, so Natalie is in here. She's about 20 weeks. I took her vitals and her blood pressure was a little high, around like 140 over 90, which is kind of concerning, so I was hoping you could go and take a look with her.
Sure, thanks. Hi Natalie, how's it going?
Hi, Dr. Tan.
I'm Dr. Tan. Nice to meet you, Natalie.
Hi.
Okay, I have a couple questions for you. So, my nurse told me that you have a slightly higher blood pressure than usual. So I have a couple questions for you. You have a headache that won't go away?
No, not really.
No? Okay. Do you have any difficulty breathing?
No, other than my baby pushing up against me, but no. I feel
Any
okay.
huge sudden weight gains? Like, you're supposed to gain, about a pound.
No, I've only gained a couple pounds so far,
Okay.
and
So it's gradual?
yeah.
Okay. Alright. And then any nausea and vomiting?
I did in the beginning
Right,
of
which
my
is normal.
pregnancy. I had nausea a lot in the morning.
But at this point?
No, I don't. It's gone away.
Perfect. You see any spots or changes in your vision?
No.
Okay, perfect.
So, pregnancy-induced hypertension, what does this mean for my baby?
It could mean that your baby will get less nutrients, and resulting in lower birth weight. But we've caught it early, and you have every reason to expect your baby to come out healthy, because we're going to take great care of you, Natalie.
Thank you. That's reassuring. So, what are some things that I can do then to manage it?
Well, when you're at home, you can lay on your left side. You need to have adequate fluids, so about 8 glasses of water a day. You're going to need to check your blood pressure rather regularly and give us a call if you're ever over 140 over 90. Top number 140, bottom number 90. I know this is the South and people love salt, but you can reduce your salt intake too.
How much? Because I love fried chicken, and I put salt on everything.
Whatever you're doing right now, less is better. So just try to minimize it, which I know you told me you have a selection of favorite foods that are very salty. I'm not trying to limit your choices here. I'm just saying,
I'm a pregnant woman. I need my food.
You will be hungry. We're going to do a checkup afterwards for your urine. We're going to analyze your urine for any proteins and such. And that's about it.
And my urine test today, did you guys get those?
No, not today. We didn't find any protein in your urine, so you're actually in good standing right now.
Hi, honey. So the doctor said I can't eat any more chicken. Fried chicken. Can you believe that? Yeah, so throw out all the salt. Apparently I can't have salt. Oh yeah, and you need to buy a blood pressure cuff. I don't know, CVS? Because I gotta monitor it. Yeah, my blood pressure's kind of high. This baby. Say doctor. Or whatever your name is.
This KFC. Do y'all deliver? Alright, cool. Okay, so bring it up to the nurse's station, drop it off. I'll leave some money there. Don't say anything about Dr. Tan, though, alright?
4 to 6 weeks later.
Good morning, this is Dr. Stan Appel.
Hi, this is Natalie Sanders.
How can I help you?
Yes, I'm one of Dr. Tan's patients. He's been watching my blood pressure and has told me to check for some symptoms and changes at home. And I've just started feeling really, really awful. I feel like my vision's getting blurry. I have a lot of swelling. I have been having a lot of headaches lately, and so just wanted to see what I should do.
Okay, so I'm pretty sure she is going to want to see you today, and he actually has an opening at 1:30. Can you come at that time?
Okay. Yes, I'm free. I'll be there at 1:30.
Okay. Okay, thank you.
Okay, thank you.
2 hours later.
Hi, Natalie.
Hi.
We're about to send you off to L&D while we're waiting on your labs because your hypertension could have progressed into preeclampsia, but we're not sure yet.
Okay.
But I'm going to send you off to L&D just in case.
Okay.
Hi, yeah, so I was editing this and I think we need a little more clarification, but we kind of forgot to record it. So we're sending her off to L&D for precautions. We're waiting for her urinalysis to see if there's a significant amount of protein in it, which is a diagnostic for preeclampsia. So we want to send her to L&D since she is having these headaches and all of that and high blood pressure, just in case it's worsening to preeclampsia, so we could have her on magnesium sulfate and some high blood pressure medications to help with her headaches and her high blood pressure. And
But I do have one more question for you. Have you been reducing your salt intake?
Yes.
Oh, really? What have you been eating recently?
Well, I've been craving ramen noodles a lot, so I've been eating a lot of that.
Ramen noodles?
Mm-hmm.
Do you use the whole packet of seasoning?
Why wouldn't I?
so I'm here with Dr. Bazine, and she's going to go ahead and talk to us about pregnancy-induced hypertension, the signs and symptoms, how you can manage it if you do end up getting it, and any populations that are at risk. So Dr. Bazine, go ahead.
Well, the interesting thing about pregnancy-induced hypertension is we're not quite sure what causes it. It's, a mechanism of the increased load of work your body needs to do to maintain a pregnancy. The populations that it affects most commonly include first-time moms, women whose mothers and sisters have had it, women who are carrying more than one baby, so twins, triplets. It also is common in women who are younger than 20 or older than 40, and women who had high blood pressure or kidney disease before getting pregnant.
Okay, so what are the signs and symptoms pregnant women should look out for?
Well, the signs your doctor would definitely want you to give them a call for would be a headache that doesn't go away, sudden nausea and vomiting after morning sickness has ended, increase in BP. If they suspect this, they'll be having you monitor that at home. They'll also want to know if you've had any changes in your vision, any sudden swelling, any difficulty breathing, or right upper quadrant pain.
Okay, and so say they do have it, how should they manage it to maybe avoid it from getting worse?
So if you didn't have high blood pressure before you got pregnant and all you're dealing with is mild hypertension in pregnancy, and until your baby is fully developed, your doctor will probably recommend that you get enough rest. When you rest, you lie on your left side to ensure adequate blood flow to the fetus. You'll have more prenatal checkups. They'll encourage you to decrease your salt intake and make sure you're getting enough water to drink. And they may look into using blood pressure medication to manage your blood pressure.
So how would you prevent getting pregnancy-induced
There's no way to
hypertension?
guarantee that you won't get pregnancy-induced hypertension. It can happen to women of regular health, of normal body weight. But things that we would encourage would be to limit your salt intake, drink enough water, increase your protein intake, and limit the amount of fried food and junk food that you eat. We'd also want you to exercise regularly, avoid caffeine and alcohol, and take whatever prescriptions and supplements your doctor recommends.
Okay, so how would your doctor monitor you for this?
Once you've been diagnosed with pregnancy-induced hypertension, your doctor is going to look very closely at the regular urinalysis you have at your prenatal checks to monitor for any protein that's showing up in your urine. They'll also be looking at your lab work, your blood tests, to look for your liver function and your kidney function, because that can be a very good indication of how your body's responding to the pregnancy.
Awesome. Well, there's your inside scoop on pregnancy-induced hypertension. Thank you so much, Dr. Bazine, for the information. If you or your loved one think that they might have it, there are community resources available. I know they have, if you don't have a blood pressure monitor at home, you could always go to CVS, HEB, and use the ones there at their pharmacy. Planned Parenthood also has resources on pregnancy-induced hypertension. And Memorial Hermann actually has a hotline where you could talk to a nurse for free if you have any questions or anything that might be concerning to you. PSA, fried chicken is not actually like a thing. Sponsor this, Chick-fil-A, if you're watching. Sponsor us. I don't like what I said. Hold on. Okay.
How much salt?
We should have bloopers again.
Guess that means the cigarettes are out too.
Yep.
Of seasoning?
Why wouldn't I?
Or I'm ready to sue. What is the line?
I feel like this is real.
It does look real. You can even see your belly button.
Oh shoot. Yeah. Dr. Tan told me to monitor.
What's up?
God dang it. I have gestational diabetes, or gestational diabetes.
Wrong topic.
That's